everybody. Happy Friday. I know, we call it Fry-yay in my house because it's the last day of the week. We look forward to the weekend. So arthritis is a pretty common condition, especially as you age. So who here has arthritis pain that limits mobility? Anybody? Okay. How many of you were told by a physician pain pills, injections, surgery were like the good options? How many of you were told by your physician to exercise to manage that arthritis? Yes, I like your doctor. Okay. So what we typically find is when you go through the traditional medical route, pain pills, injections, and surgery, heat, ice, like those are the things that you're given, the tools. And then, of course, surgery. And most people want to avoid surgery. They want to kind of do anything that they can to prevent it. So what we're going to do today is talk about all the things besides surgery that you can do to manage your arthritis long term. So as Ted mentioned, I'm Dr. Beth. I'm a board-certified specialist in geriatric physical therapy. So just like physicians can get board certified in different fields, so can physical therapists. That just means I've had additional training experience and testing to become board certified. I am the owner of HouseFit Physical Therapy and Fitness. We are a geriatric specific clinic, meaning my youngsters are in their 60s. Most of the folks we work with every day are in their 70s, 80s, and 90s. This is what we do every single day. These are my daughters, Harriet and Estelle. For the 100th day of school, they asked the kiddos to dress up like 100-year-olds. Have you heard of this? So my daughters wanted gray hair. And yes, graying hair is a normal part of the aging process. So I was very happy to spray paint their hair gray. They wanted to wear glasses. And changes in our vision are a normal part of the aging process. So we found some old sunglasses and we popped out those lenses. They wanted to wear clothing that made them feel like a granny, and for them that was a dress with cardigan and pearls. And then they wanted to be cool grannies, so they asked to wear hot pink lipstick, right? But as we were leaving to go to school that day, my oldest daughter, Estelle, who was only 7 years old at the time, asked me if she could have a cane to complete her outfit. And that broke my heart. That at that young age, she already had all these negative beliefs about what it meant to get older. And when I looked into it further, the World Health Organization says children as young as 4 years old have negative beliefs about aging. That you're going to be weak, senile, dependent on others, okay? So hopefully we'll bust some of those myths today. But background, we've got a very loud room next door. We know that arthritis, it affects more than 58 million people. According to the Arthritis Foundation, it's going to affect 25% of folks. We know that it is more common as you age, so the older you get, the more likely you are to develop it. But interestingly, it is the most common in inactive adults, so those who are not exercising on a regular basis. The problem is arthritis is the leading cause of disability in the United States, making it very costly to manage. And when we look at it, it most commonly shows up in the hips, the knees, and the hands. But when you say the word arthritis, arthritis literally describes more than 100 different conditions. So for today's purposes, we're going to focus in on osteoarthritis because that is the most common form of all the arthritises, especially in aging adults. So osteoarthritis, again, is the most form and common of arthritis. It is the second most costly health condition to manage when you factor in disability, pain pills, injections, surgery, rehab, and recovery, okay? It's characterized by pain, stiffness, swelling, decreased motion, and it often leads to difficulty with mobility, difficulty with self-care activities, okay? And it's really different for everybody. So why I say that is I have clients who have gone to get x-rays for something else and then found out they have bone-on-bone arthritis, yet they have no pain. And then I have other people who have very debilitating pain, but the x-rays don't show that. They show mild degeneration. So knowing that the x-rays don't always tell the whole story, that what shows up on a picture doesn't mean that that's how it shows up in real life. Okay, so we kind of take all of that information into consideration when helping folks to make decisions. So there are many myths surrounding arthritis. So we hear that arthritis is inevitable, meaning everybody's going to get it, and progressive, meaning that once you get it, it will only get worse. Well, while arthritis affects 25% of people, that means there are 75% of us that don't have any arthritis symptoms. So it's common, but it's not an inevitable part of getting older, okay? And once you have it, there are things that you can do besides pain pills, injections, and surgery to help you manage your arthritis and heal it so that you're not experiencing that pain, okay? We hear things like arthritis is caused by wear and tear. And so people think the more they use their joint, the more they break it down. But the opposite is actually true. We say motion is lotion, okay? The more you move the joints, the more you're hydrating that joint and keeping it healthy. Okay, so we kind of need to replace wear and tear and replace it with wear and repair. That the more you use that joint, the healthier you're actually keeping it. We hear there's no good treatment options besides the pain pills, injections, and surgery. And there are things that you can do, and we'll talk about all of those today. I hear things like, I can't do that because of my arthritis. So I've been told people can't kneel anymore. I'm not allowed to kneel. I'm not allowed to lift heavy things. I'm not supposed to squat. I'm not allowed to reach overhead. I'm going to flare up my arthritis. I'm going to cause more injury, okay? And usually that's not the case, and we'll talk about that as well. I hear things like I should focus on low impact exercise, and I love low impact exercise. It is a great way to get started with somebody who has arthritis pain, but there's no reason why you can't do high impact, high intensity, vigorous exercise. We just got to work slowly to get you there. And then again, it's unsafe to do an exercise that hurts. And this makes sense. If I have pain every time I go up a step with my right leg, it makes sense to not do that to protect that knee. But when you do that, that muscle gets weaker, that joint gets stiffer, and the next time you go to do that same activity, the pain actually gets worse. So we need to kind of reverse that cycle and figure out how to get you stronger, more flexible, get that body more resilient. So what actually causes arthritis? And again, this is very specific to osteoarthritis. So you guys know that we have bones in our body, right? And where two bones meet, you have a nice protective layer of cartilage covering the bone. The cartilage lets the bone slide and glide against each other, nice and smooth. As we get older, that cartilage does begin to break down. It typically breaks down from years of friction and things like dehydration, okay? So that cartilage starts to break down. Now, our body does not have a really good ability to regenerate cartilage, but we do have the ability to rebuild bone. So what happens is our body detects that that cushion has gone down and it tries to rebuild it, but the only way it can by rebuilding bone. Now, we can build bone pretty well, but when we do, it's not real smooth. It's not a soft cushion. It's jaggedy, is that a word? Let's pretend it is, okay? It's pretty jagged and rough. And then when the bones rub on each other with that unsmooth surface, it creates a lot of friction. That friction creates inflammation, okay? So we lose our cartilage, we build bone to try to repair it, we get the spiky, uncomfortable, unsmooth bone, and then it creates inflammation, okay? Inflammation is responsible for the pain, the warmth, the swelling, the stiffness. The problem with inflammation is it further breaks down the cartilage, and then the cascade starts all over again, and you get more inflammation, which breaks down the cartilage even more. So when we talk about ways to manage arthritis, a lot of it is looking at how do we break this cycle. So we're really looking at how do we take care of the inflammation? How do we take the inflammation out of our bodies and out of our joints to manage the arthritis better long term? So when I talk about arthritis, I talk about two treatment buckets, okay? The first bucket we're going to talk about is everything you can do in your life to improve the health of the joint and decrease the inflammation in the joint. Bucket number 2 is going to be, how do I manage the pain so that I can do all the things I need to do in bucket number 1, okay? So bucket number 1, we're going to take a deep dive into exercise, weight loss, and other lifestyle changes. So when we talk about exercise, and all of this information is taken from the Academy of Rheumatology. They put out a study every 10 years doing a look back of all of the published research, and then they summarize it for us. Okay, they make it easy. The number 1 recommendation for arthritis is strength training, resistance training, okay? So this isn't just doing 2-pound dumbbells at the gym. This is progressive resistance training to where we're actually building stronger muscle, okay? And it has to be done twice a week, and we recommend a day or 2 of rest in between, okay? But strength training is the single best thing you can do, and there's several reasons why. So let's take knee arthritis, because that's one of the most common. Every time I take a step, impact from that step is traveling up my leg. Now, in a healthy body, let's say that 50% of it gets absorbed by the muscle, because it acts like a shock absorber, so that only 50% is going to the bone. As we age, we lose bone mass at a rate of 3% per year. So now fast forward a couple decades, and now every time I take a step, I don't have those good healthy shock absorbers in my thighs. So more of the impact of every step I take is going directly to that knee, okay? So if I simply strengthen my thighs, the quadriceps, the big muscle in front of my thigh, I now have built-in shock absorbers to help kind of absorb the pain and the impact from my joint. The other thing that strength training really helps with is keeping the joints in good alignment, okay? If you have an imbalance in your muscles, the joints can rub on each other funny, and that's going to really, that wear and tear is kind of what causes the cartilage to break down when you don't have good alignment in the joints. And we really see that a lot in the hips, the shoulders, and the back, okay? But strength training is the number 1 recommendation for exercise. A close second is aerobic exercise, and we'll talk about that more in the next slide. Tai Chi, it gets a bronze medal, and then our runner-up is balance training and flexibility training, things like yoga. Okay, when we're looking at arthritis. So with aerobic exercise, people always ask me, what is the best kind of exercise for arthritis? Is it swimming? Is it walking laps? Is it cycling, rowing, walking, running, doing those new steps, ellipticals? What is it? The research can't tell us one is significantly better than the other. What's more important than the type of cardio you do is that you do it on a regular basis, okay? That you do it long term. So what do you have access to? Here at the gym, you guys have every piece of equipment you probably could desire, right? What do you enjoy doing, okay? What's gonna keep you consistent with it year after year after year? Those are the things that are more important than rowing versus cycling versus swimming, okay? There is a lot of research out there showing that exercising in a group setting, you're going to be more likely to be successful long term than trying to do it on your own. So group can just be as many as 2 people. So if you even have a walking buddy, somebody that's going to meet you at the track, you're more likely to show up even on a day that you don't feel like doing it. If you sign up for group exercise classes, there's accountability there. You're more likely to show up. When you have a paid gym membership, again, you're more likely to show up and do it than if you don't have to have that cost. So the research does show that having a partner, a workout buddy, or a class setting to hold you accountable will make you successful long term. But this is actually why physical therapy is so successful. You show up and your therapist gives you all that attention, you do the right exercises at the right intensity specifically for you. This is why we get such great outcomes when we see our folks for therapy. All right, minimum. So this is actually the old minimum. So the minimum, this is pre-COVID, was a minimum of 150 minutes a week of moderate intensity exercise, or if you want to exercise a little bit harder, 75 minutes. When COVID came along, they actually doubled these recommendations to a minimum of 300 minutes a week of moderate or 150 minutes a week of vigorous. Okay? And that's in addition to your 2 days a week of that aggressive strength training. So how do we know if an exercise is moderate or vigorous? So light exercise, which is the easiest level, you have enough breath power to have a conversation with the person you're exercising with. You would even have enough breath power to sing a song. Now at moderate intensity, you're exercising a little bit harder. So you could still hold on a conversation with the person you're exercising with, but you wouldn't have the breath power necessarily to sing that song anymore, because more of your lung energy is going towards fueling your body to move. With vigorous activity, you no longer have the breath power to sing or say a sentence. You can maybe say 2 or 3 words before you're taking that next inhale, because all of your breath power is going towards moving your body, okay? And so as soon as I tell people that, they're like, wait a minute, Beth, is exercise at vigorous intensity safe for aging adults? The answer is yes. Now, that may not be where we start you on day 1, especially if you haven't exercised in a while, but that's our goal, is to get you there safely as fast as we can. Now, this brings me to that low intensity exercise. I have people that are like, my doctor said, because of my arthritis, low impact only. And while I love that the doctors are educating you that exercise is a good option, they're educated to prescribe medications. My education is to prescribe exercise. So while I know a little bit enough about medications, maybe even enough to make me slightly dangerous, I always try to defer towards the pharmacists and towards the physicians that have the training in that. And again, I love low intensity for specific people. If you have very low endurance because you haven't exercised in a while, this is a great place to start. If you have significant pain in your joints, this is a great place to start. I like to encourage my folks to do exercise snacks. Have you guys heard that term before? Who likes a good snack? I snack all day long, guys. So an exercise snack is a short bout of exercise. It can be anywhere from 10 seconds to like maybe 3 to 5 minutes. So what we encourage people to do is just to start snacking during the day, okay? In the best way possible. Like, I know my smartwatch will tell me at 10:50, 11:50, 12:50, every 10 minutes before the hour, if I haven't been up and moving, it'll give me an alert, time to stand up, okay? And if I honor it, I actually feel better getting up and moving. So it could be when you're watching a TV show, getting up and doing a couple of laps around the house on the commercials. It could be doing up and down from the chair 10 to 20 times in a row. It could be, instead of going up and down the stairs once, do it 2 or 3 times in a row, just to get your heart rate up a little bit and break up sitting throughout the day. And we do think too, though, with arthritis, it's really important to start with a good warm-up. You're warming your body, you're priming it for that more intense exercise, making it more likely that your joints will be less angry with you if you do a good warm-up first. High intensity, though, as I mentioned, we like to get our folks to high intensity as fast as possible because you get all these other health benefits. So it helps aid in weight loss, and we'll talk about why maintaining a healthy weight is so vital, especially with arthritis pain. It helps to lower your blood pressure, lower your cholesterol. It improves the strength of your heart. We love that. It decreases insulin resistance. So insulin resistance is what causes diabetes. So we can help manage diabetes with exercise, especially high intensity. When you do high intensity exercise, it's going to decrease stress, anxiety, and depression by releasing endorphins and all of these other great hormones that help regulate mood and emotion. And so this is why we like the high intensity, because you get all of the other health benefits in addition to helping to manage that arthritis pain. So again, we get the question, is it safe for me to do something that hurts? Oftentimes the answer is yes. So what I like people to understand is that hurt does not equal harm. And I get it, in our logical brain, if something hurts, you're worried about continuing to do it because you're worried about causing further damage to the joint. And we don't want to do that, right? But pain is just a warning signal in your body. It's a warning signal just to pay closer attention to what's going on, okay? So what that pain is likely telling you is that there's weakness in that joint, that there's stiffness in that joint, that you don't know how to move your body correctly to support it. And that can all be corrected with exercise. So we do a lot of things, especially like teaching people how to kneel again. And we do things like graded exposure. And we start to get the body stronger, get the body used to having pressure on the knee, and we build up slowly, okay? But yes, the answer is most of the time, yes. If something hurts, it's still okay to exercise. Weight loss. So weight loss is vital, not just for overall health, but in particular for arthritis management. So when we're looking at health, the CDC says if you're carrying extra weight, you only need to lose 5% of your body weight to start seeing improved health benefits. So lower blood pressure, blood sugar, cholesterol, decreased risk of cancer, Alzheimer's, all the stuff we don't want. So if you're 200 pounds, we need to lose 10 pounds to start seeing those health benefits. If you're 160 and you're overweight, you would need to lose about 8 pounds to start seeing health benefits. As we look at it specifically related to arthritis, the number is actually less. But the reason why it matters is for every pound of weight that you're carrying in excess, that's putting 4 pounds of pressure on your lower body joints. So think about your low back, your hips, your knees, your ankles, and your feet. So that same 10-pound weight loss that they're recommending for improved health gets you 40 pounds of pressure off of your lower body joints. This is why weight loss is one of the best ways to manage arthritis or maintaining that healthy weight if we're having arthritis in any part of our lower body, okay? It has such a significant impact, literally, on your joint health. Lifestyle changes. So again, these are gonna focus on ways to decrease that chronic inflammation in your body. And I'm sure that you guys have heard that these are all important things to do, but they're hard. And that's why people don't do them or they struggle to do them consistently. But here's how these lifestyle changes help manage arthritis. So when we look at sleep, we need enough hours of sleep. So the minimum recommendation is 7 to 7.5 hours. And we need the right kind of sleep, okay? So we go through different sleep cycles. There's awake, light sleep, REM, deep sleep, and we kind of cycle through all of these different stages. In order to heal the body, so in order to repair muscle and bone and cartilage, to keep everything as healthy as it needs to be, we have to enter a deep sleep cycle. REM is where the brain does all the healing. Deep sleep is where the body does all the healing. As we age, we have a harder time getting into deep sleep and a hard enough time staying in there long enough to actually let our body repair. The hack to get more deep sleep as you age is intense exercise throughout the day. As little as 30 minutes of exercise a day helps you get into that deep sleep phase more consistently and stay there longer so that your body can do the job of repairing itself at night while you sleep, okay? But we have to have good sleep to maintain good health in our body. Stress. Nobody has stress these days, right? So everybody's probably heard of our stress hormone, cortisol, right? As our stress levels go up, the cortisol level goes up as well. The problem with cortisol is it's very inflammatory to our body, including our joints. So the recommendation is to spend 10 minutes a day working on de-stressing. So this can be deep breathing, meditation, yoga, going for a walk outside, journaling, doing an adult coloring book, having a cup of coffee on the back patio and sitting in silence. Spending 10 minutes a day has been shown, if you do it consistently, to decrease your cortisol levels, which is going to decrease the inflammation in your body and including those joints, okay? Hydration. This is probably one of my number ones besides exercise. So our cartilage, that nice cushion on the edge of the bones, is about 80% water when we're younger. As we get older, it decreases to about 70%. And when your cartilage is dehydrated, you're more likely to injure it. So I tell people to think about a sponge. Okay, if that sponge is bone dry, it's not very flexible. You can't really twist it or anything, or if you do, you're likely to flake off some bits of that sponge. If you take that same sponge and you dunk it in water and then you pull it out, you can bend it and twist it. It is robust, it is resilient. The same thing goes for your cartilage. When your cartilage is hydrated, it has better ability to sustain challenges, wear and tear, injury. When it is dry, it is more likely to have additional injuries to it, okay? This is the reason why arthritis pain is usually worst in the morning. You've just gone 7 to 8 hours without drinking, and so you're at your most dehydrated first thing in the morning, okay? So what I do is I put my water bottle, and I like a little lemon flavor in mine, so I do one of those lemon packets. I put it in there the night before. That way when I wake up in the morning, that's the first thing I see, and I drink it down, and I think I'm hydrating my sponges for the day. Okay, I'm gonna protect my cartilage while I can. So what do you guys think the recommendation is for fluids per day? What have you heard?
8 glasses of water.
So 8 glasses of water, 64 ounces. And that was the mindset years ago. Now we're shifting towards half of your body weight in ounces. So I'm about 140, so I need to drink about 70 ounces of fluid a day. My husband is a big guy, he's 220. He needs to drink about 110 ounces a day. But our body is 70% water, so it makes sense that the bigger you are, the more volume you have to drink. So with that being said, most adults, what they're finding are chronically dehydrated, so we're literally causing damage to our cartilage every single day, okay? So the only exceptions to that would be if somebody has congestive heart failure, if somebody has kidney disease and they're on a fluid restriction, we would have you work with your physician because that would trump the generalized recommendation. I see somebody getting ready to take some water right now, bravo. But yes, so keeping that cartilage hydrated, keeping it as healthy and robust as possible. Diet. So we now know that there are foods that are pro-inflammatory, that are gonna increase inflammation in your body, and there are foods that are also anti-inflammatory that are gonna decrease the inflammation in your body. So the goal would be to start phasing out some of those pro-inflammatory foods and replacing them and adding more anti-inflammatory foods onto your plate. So the pro-inflammatory foods, and this is where I make all of my enemies, are dairy, red meat, processed food, fried food, alcohol. Those are the big guys, okay? The anti-inflammatory foods are gonna be all of your plants, so your vegetables, your fruit, your grains, so your rice, your beans, lentils, all of those types of things. We work with people to coach them on having a more plant-based diet, and the people that start giving up the dairy and the red meat and they eat a more whole food plant-based diet, the first thing they tell me is how much better their joints feel. It does work. It just matters how much of that change you're willing to make, okay? The last one is mindset. So we now know the impact of self-belief in being able to heal the body, okay? If you believe that you can make positive changes in your life, if you think I'm gonna exercise, I'm gonna manage my stress, I'm gonna try to make sure I stay more hydrated, okay, I'm gonna make a couple of changes in my diet, I can do this, I can heal my arthritis, you're more likely to achieve that outcome. Whereas if you think, you know what, it's all genetics, my grandma had it, my auntie had it, my sister had it, I'm bound to have it, there's nothing I can do, this is my path, then guess what? That will be your path. And they've done study after study showing that your belief system helps set the trajectory that your body follows, okay? So that's all treatment bucket number 1. Switching gears to treatment bucket number 2, because guess what? If you're in a lot of pain, it's hard to prioritize exercise and get good sleep and think about meal planning and do all these other things if you're living in constant pain. So let's take a look at what do we do to calm the pain while your body takes its time to do the healing. Okay, so things like pain medications, injections, and acupuncture are what we're going to talk about. So there are recommended medications that are considered the top line when it comes to arthritis pain. These are your NSAIDs. So ibuprofen, Aleve, Malexiacam, Celebrex, diclofenac. I think Voltaren should be in there. Okay. The reason why these work is NSAID stands for non-steroidal anti-inflammatory drug. The reason why it works is it's in there. It's an anti-inflammatory. These drugs are pushing the inflammation down in your body. This is why you're getting pain relief. So you can choose to do it by taking medications, or you can choose some of the lifestyle, or if it's bad enough, you do both, okay? But that's why these medications work so well. The problem with these medications is they have a lot of side effects, particularly on the gut. So these medications taken long term have a high risk for GI bleeds, for ulcers, and if you have compromised kidney issues or liver function going on, they put a lot of wear and tear on those as well, okay? So second line of defense would be Tylenol, okay? And sometimes we even have people rotate Tylenol and ibuprofen throughout the day to get better pain coverage. Tramadol is another one. This one is by prescription only, and it's a stronger medication. Duloxetine is actually a medication that's commonly used for depression, but they have found really good pain relief in folks that are taking it for depression. And capsaicin is gonna be those topicals, like those peppery, icy hot, those types of things. So again, these have all been shown to be helpful and effective at decreasing arthritis pain. The medications that are not on there are all of your narcotics. The Percocets, the Vicodins, the oxycodones, the Norcos. Those are not on the list of recommended drugs for arthritis pain. Okay, so when people show up and they're on those for their arthritis pain, we work with them and their doctors to see if there's a way to get them off of them, okay? Other pain reliefs. So has anybody had a steroid injection? Got a couple. So steroid injections have gone from very hot to very cold to now we're kind of landing in neutral, okay? So steroid injections are effective at getting short-term relief. The problem is repeated injections deteriorate your joint faster than it would on its own. So if somebody is really desperately in pain, we still say, okay, that steroid injection is all right, but let's do that in conjunction with physical therapy. So the recommendation is that it's not a standalone intervention, but we get the injection to decrease your pain, and then you get aggressive physical therapy. Because guess what? If you just get that injection and you do nothing else, as soon as it wears off, your body hasn't changed. If you get that injection and the pain goes down and we can aggressively strengthen you and work on your motion, now when that pain wears off, the pain medication wears off, your pain level should hopefully have gone down as well. Okay, so they recommend them in conjunction if you're going to get them. Acupuncture has been shown to be effective. So 10 years ago when they published this, it wasn't really all that exciting. More and more research has been done to show how effective acupuncture is at managing arthritis pain. And then footwear is an important part of the equation. So our joints are all interconnected. As we age, we're more likely to get prone or flat feet. And the problem is as our feet flatten out, our knees get pulled in, our hips rotate, it changes the position of our back. So sometimes just by getting good arch support to kind of work on the links in the chain for good alignment takes some of the stress off of our joints. No longer recommended. So these were things that used to be the bee's knees. I know, I'm sorry guys. That are no longer supported by the science, okay? So glucosamine and chondroitin supplementation. When I started my career 20 years ago, every single person I saw was on these meds, okay? That was the science, that's what we knew. They have now found that even though these are important building blocks in our body for healthy joints, they can't figure out how we digest it and get it from our gut to the right place in the body. So now they believe that we're mostly just peeing all these out. So if you're one of the people that started taking these and got amazing relief, keep taking them. But if not, then you can talk to your doctor about getting off of them. TENS or electrotherapy, again, this has its place, and it's really helpful sometimes still with muscular injuries, but it's not effective for joint pain. So again, this is no longer recommended for arthritis pain. Arthroscopic lavage and debridement. Have you guys heard of these, where they go in and they scope out or they go clean out the joint? This was very commonplace. No longer recommended. What they've done is they've done sham surgeries. So a sham surgery, they make an incision into the skin, but they actually don't go into the joint itself. They don't penetrate that joint capsule. And they tell the person they had surgery. So they had 50% of the people go through that, and then they had the other half actually get the full surgery where they went in and they cleaned out the joint. The people that got the sham surgery had better outcomes than the people who actually got the surgery. This is why they think that these are no longer recommended. Because once you go in and you go into that joint capsule, your joint deteriorates faster. So you're more likely to need that joint replacement sooner. So this is the other, again, the placebo effect. If you're doing something and you think you're gonna feel better afterwards, even if they didn't do the surgery, you thought you were gonna feel better afterwards, you did. So this shows the power of mindset. Now, the exception to this is if you actually have a meniscus tear and you're locking. If your knee locks up from meniscus tear, this is still appropriate in that circumstance. But if your knee is not locking and getting locked in place, they no longer recommend getting your knee scoped out. And then the hyaluron are the gel injections. So the gel injections differ from the steroid injections, and these are no longer recommended. Again, what they have found, we thought they were the best thing in the world when they first came out. Long-term effects, they break down the joint even faster. So they're not recommending them. And the difference between these gel injections and the steroid injections are, steroids are anti-inflammatories. That's why they work, guys, when they work, right? Because they're decreasing the inflammation in the joint. Okay, very different from a hyaluron injection, which is a synthetic cartilage type thing. And again, they just haven't perfected them yet. So oftentimes people will say, Beth, well, when should I get joint replacement surgery? So for hips, knees, shoulder. When should I think about back or neck surgery? Okay, so ideally we want to go through 6 to 12 months of conservative therapies. Diet, exercise, hydration, stress management, sleep. Okay, and if the pain is still there and it's still limiting your ability to move and function every day, then you might need that joint replacement, and that's okay. So we do recommend something called prehab. Has anybody heard of this before? So prehab is going through physical therapy before your surgery. The goal is to prepare your body for the surgical procedure. When they go and do a joint replacement, they're only replacing the bony surfaces. They're not touching your ligaments or your tendons or your bones, or your muscles, okay? The stronger you are going into the surgery, the better you recover after surgery. Also practicing, how do I get in and out of the car, in and out of bed? How am I gonna go up and down stairs? Practicing that stuff beforehand makes it that much easier to do afterwards when you're in pain and potentially a little bit foggy from the pain pills, okay? So we do offer prehab, and then after, when I started 20 years ago, I worked on the ortho floor at Big Barnes. And I was the young girl who would come and pull you out of bed the day after surgery, and we would get you up twice a day. We would see you twice a day for 5 days before you even left the hospital. My mom got her knee replaced 2 years ago. She was home by 3 p.m. that day. I couldn't believe it. Like, how is Dad managing you at home? Unless you have a cardiac issue where they want to monitor you overnight, it's same-day surgery and you are home. They don't even order home health. They tell you to wait 2 weeks before even showing up at outpatient therapy. That's kind of the standard of care these days. We find that a lot of people struggle with that. And so we see a lot of our folks, since they're skipping the home health, we do outpatient in the home. So we have a mobile team, and we actually go see our clients in home fresh post-op to kind of fill in that home health gap, and then we can see them back in the clinic once they're ready to come on in. But again, if you're planning for a joint replacement, asking what does therapy look like and getting those timelines so that you know what the standard of care is these days, because it has changed dramatically over the last 20 years. So back to other options. So regenerative therapy is something we just added to our clinic about 1.5 years ago. Has anybody heard of EMTT or shockwave? Great. So this is your introduction. This is your crash course. So I stumbled upon regenerative therapy because a friend of mine told me it would be a great addition to my clinic. And I at first ignored him because this was brought into the United States from Europe to treat athletes. So the NFL, NBA, NHL, MLB, what letters am I missing? All the pro peoples, okay? I'm not a sports girl, sorry guys. All the Olympic athletes. They're using these to return their athletes back to play faster. So I told him, I was like, Keith, I don't treat athletes. He's like, Beth, there's amazing outcomes for arthritis and spinal stenosis and degenerative diseases. I was like, great, those are my people, tell me more. So the goal of regenerative therapy is to repair and regenerate damaged tissue without medications, injections, and surgery, okay? It accomplishes this by triggering your body's own natural healing process to repair the tissue, push out the inflammation, right? That's a key indicator for arthritis, and then we get the decreased pain. So the advantages are faster healing. So we're gonna get you healing faster than your body could do on its own. It's non-invasive, so no injections or surgery. There's no downtime or recovery. Drug-free, which is so important. As we age, we're on more and more medications, and the cutoff is 4. So if you're on 4 or more medications, you're at risk for polypharmacy, which means higher risks of drug interactions and actually a higher risk of falls. So if we can treat your pain non-pharmacologically, that's a win, and it's really effective pain relief. So we have at HouseFit, we have EMTT, radial, and focused shockwave, all of which have been approved by the FDA for pain management. This is a brief overview. So how EMTT works, it uses high energy magnetic impulses to decrease inflammation and pain in the body. It actually hits the cells, and it's like hitting the reset button. I tell people a healthy cell does not send out a pain signal, just a damaged one does. So if we can reset the cell, we can take away the pain signal. Okay? Then shockwave is the other 2 machines. This uses high energy acoustic waves, so slightly different. And what it does is it stimulates cellular metabolism, increased blood flow, and accelerates the healing process. In simple terms, when the sound waves hit a damaged cell, it creates micro tears, okay? That's our body's signal to turn on the healing process, go back in and heal it, okay? So focused shockwave has the ability to repair muscle, tendon, ligament, blood vessels, nerve, lymph, and bone. And the fact that it can heal the bone has been a game changer when we're working with hip, knee, shoulder, and even back arthritis, okay? So common conditions that we're able to treat with this at the clinic, arthritis, both osteoarthritis and rheumatoid arthritis. Things like any kind of pain, whether it's, what do I have here? Muscle pain, tendonitis, bursitis, neck, back, shoulder, hand, hip, knee, foot, ankle, and nerve pain. All of these things, anything that is musculoskeletal, can be treated with these technologies. So again, the benefits are it is evidence-based. Even though I hadn't even heard of it before 2 years ago, it's been over in Europe for the past 20 years, and it's finally slowly making its way across to us. Non-invasive outpatient treatments, so we don't have to have you doing hospital stays or anything like that. A wide range of applications. Another benefit is no anesthesia. I know some of my folks are not surgical candidates because they're not cleared for the anesthesia, either due to heart issues, kidney or liver issues. There's no risk of infection or scarring because we're not breaking the skin. No side effects, and faster, easier healing. So if you guys do want more information specifically about regenerative therapy, I have a guide over here, a little 10-page guide that's like a Cliff Notes version introduction to it. Yes?
This sounds a lot like red light therapy
Yes.
that I've been learning about at OsteoStrong.
Yeah.
Is this the same type of thing?
So she asked about red light therapy. Red light therapy does fall kind of under that regenerative medicine umbrella. So regenerative medicine would be red light therapy, hyperbaric, EMTT shockwave. Those are all the non-invasive ones. And then things like PRP and stem cell, they're the invasive regenerative medicine. So there's a big umbrella that they fall under. Red light therapy does have a lot of benefits, but from what I know, they're more superficial and they're more, they're not as specific as what the shockwave and the EMTT would do. So I am not an expert on red light therapy. It's something that I am interested in and I do want to learn more about. But I do think that the red light, from what I've seen, is more superficial compared to this. Like the EMTT penetrates 7 inches deep. With the like shockwave, I can get 18 centimeters deep. I can get 7 inches into your skin. So I can reach further with that than I can with my hands doing like manual techniques. But yes, I love the idea of red light therapy. I would love to own one so I could lay in it every day and refresh my body, but it's on my wish list, right? So we've talked about a lot of things today, and I'm hoping that you're walking away maybe encouraged to make some changes in your life, okay? So we know that by eating a healthier diet, and personally, I'm vegan. When I learned all this stuff, I gave up all the dairy, all the meat, tried to get rid of as much of the processed food as possible, and I feel a lot better. You don't have to be hardcore, but we say start with 1 meal a day. Pick breakfast and try to pick 1 meal a day to start pushing out some of the pro-inflammatory food and bring in some of the anti-inflammatory foods, right? Exercise regularly. If you haven't been exercised in a while, start with exercise snacks and start building up movement every single day. Making sure that it's a regular part of your week. Getting enough sleep. So we want good quality sleep and enough hours of sleep. Reduce the stress levels, committing to 10 minutes a day of something that is a mindfulness or a gratitude activity. Lose or maintain your current weight, just to keep the stress off of those lower body joints. Improve your strength, not just to stay independent, but to add shock absorbing capacity to those joints, and stay hydrated to protect that cartilage. So, another reminder that pain does not always equal more damage. Just because something hurts doesn't mean you shouldn't do it, but you might need to work with a specialist to help you modify it and grade it appropriately to return you back to that activity. Pain will typically decrease when you repeat the same activity over and over because your body's responding to that demand in a positive way. And a lot of this has to do with your belief in your body's ability to heal itself will allow it to do so or not. And the biggest takeaway is arthritis is less common in active adults. So stay active, and even if you have arthritis on the x-rays, you may not feel it and it may not impact you in your day-to-day life. So at HouseFit, if somebody comes in with severe arthritis, this is our approach. So we offer EMTT, because EMTT will push inflammation out of the joint. Okay, we're gonna push that inflammation out, settle that angry pain down. We use radial shockwave, which is really good at treating soft tissue. So we treat all of the muscles and the ligaments surrounding the joint. We use the focus shockwave to actually target the joint line and the bone itself, because that's the one that's strong enough to heal bone. Now, the first 3 things take care of the pain, but taking care of the pain alone doesn't mean you're gonna have good long-term results, because we need physical therapy to get your joints stronger, more flexible, and return you to function. And then, depending on your willingness to be coached, we coach on all the other things: the stress, the sleep, the hydration, the diet, and really try to give you a well-rounded program to keep that inflammation down long-term, okay? And for those of you who have never heard of HouseFit before, we are a team of physical therapists dedicated to the health and wellness of people age 55 plus. And again, I'm a geriatric specialist, and our team is devoted to working with aging adults, So I think we have a much better understanding of what normal aging looks like compared to what we consider accelerated aging due to inactivity, illness, or injury. Okay? So we do have services. Now, my gym is down in South County, which is a hike for you guys, but we do have a mobile team. So we do have a team that comes and does the physical therapy and training sessions in the home, and we do have a therapist that comes out all the way to O'Fallon. She actually lives in this area, so she loves it when she gets to hang out in St. Charles all day. So if you guys are interested at all in more information from us, as I mentioned, I have information on regenerative therapy. We offer a free consultation. You can come down to the gym. We'll allow you to come down, but we also do the free consultations in the home if that works out easier for you. But I will go ahead and open it up for questions. So what other questions do you guys have for me today? Yes, sir.
Any of these services covered by Medicare?
The question is, are any of these services covered by Medicare? So we do not have any relationship with an insurance. We're a fully cash-based clinic. Yep. Yes?
I was just wondering on the EMTT and the shockwave, is that something that you have to continue with? Like you go through a session of like 3 or 4 treatments, or is this something that is ongoing?
Yeah, so the question is, if I do something like regenerative therapy, what does that look like? We typically see people once a week for 6 weeks. That's the standard protocol. And then the results are going to last. It's really going to depend on you. When I went to go visit my friend Keith's clinic to get the training, I saw somebody who he was working with that had rheumatoid arthritis in her hands, and she had gotten treatment and it had lasted her 2.5 to 3 years before it flared up. I'm seeing a gentleman right now who we saw last year for his knees, and it's just starting to come back after a year, and he wants to be ready for duck season. And he's like, I need to be able to crawl on the ground. He's like, it's starting to come back. I want to enjoy duck season. So it depends on how well you're doing the other lifestyle changes. So if you only do regenerative therapy, but you don't strengthen your joint, you don't manage your stress, you're eating the bad food that causes inflammation, you're not sleeping, you're not hydrating, it's likely that it's going to come back. We're not curing the osteoarthritis or the rheumatoid arthritis. What we're doing is we're managing the symptoms, but getting this done and then not having to take injections or pain pills for over a year, I think is a pretty good outcome. So we tell people that it could last anywhere from a year to 2 to 3. It just really depends on how severe your arthritis was when we first treated it and how well you're managing everything else that could contribute to it. Yes?
Is the regenerative therapy offered on your mobile unit?
Oh, the question is, do I have to come down to the gym to get the mobile therapy or to get the regenerative therapy, or would it come to me? Those machines don't travel, so you would have to hike down to our clinic. Although this time of day, I was actually surprised. I got here in under 40 minutes with no traffic. The traffic gods were smiling on me this morning. Yes?
You said that the saying, no pain, no gain. So when does muscle fatigue come in? I mean, you need to work your muscles, but then can you overwork your muscles?
So the question was about, I said no pain, no gain. That's not the right thing. So just because something is painful doesn't mean you should completely avoid it. It means you need to take a closer look at it and try to understand why it's causing pain. We don't want you to push through sharp, severe pain. That warning signal is there for a reason. So when we talk about exercise, we do want you to get cardio, 5 to 7 days a week. Strength training, though, should be done with at least 1 rest day in between. When we exercise hard and we create those muscle tears, our body does need time to repair it. Even professional bodybuilders, they might be lifting every day, but they've got a chest day and a back day and a leg day and an arm day. They're not exercising the same muscles at that high intensity day after day. So again, we work with people to create a program so you get your strengthening in and you get your cardio in. And again, if it's muscular soreness, that's not necessarily a bad thing compared to joint pain. So sometimes when we go up on a weight, they say, oh, I was so sore. Great, was it in the muscle or was it in the joint? And based on that information, then we can say the weight may have been too heavy, or let's really watch how you're performing it and make sure your mechanics are correct. And we can work with you to guide you through a pain flare-up. So it's not always, there's not always a crystal clear answer. It depends on why the pain, what were you doing, what was the quality of the movement, what was the weight, what was your rest days in between, all of those types of things factor in.
So like when I walk for longer distances, my knees, the joint hurts.
Okay.
So do I just need to warm up, or am I actually damaging my knees by doing the walking?
You're probably not damaging your knees by walking. The knee pain could just be not doing a proper warm-up. It could be not having the proper footwear. So for somebody with arthritis, we would encourage shoes with more cushion, whereas somebody with osteoporosis, we might encourage with less cushion. We want that impact. And if you have both, we have to figure out what's the bigger priority for the exercise. So it could be what shoes are you on, what surface are you on, how severe does the pain get, how quick does it go away. All of those things would factor into us altering a prescription for walk more, walk less, or walk this far, take a break, and break up your walks. Maybe not do one 45-minute walk, but do 3 15-minute walks throughout the day, and just change up how you do it until your body builds up kind of that reserve to be able to tolerate the longer. We don't want somebody exercising so hard that they're so painful for the next 2 to 3 days. That's counterproductive. You overdid it, and now we've got to dial it back to the right dose so that you can exercise successfully and then build back up on it. I hope that helps. Good. Any other questions you guys have for me today?